Hi, I'm Renee. I'm Dr. Gazelli's physician assistant and second pair of hands during surgery. You are getting ready to have a thoracic or thoracolumbar decompression infusion. Today I'm going to walk through the procedure and recovery time with you. Please feel free to take notes. I'm happy to go over further questions with you or go over more detail with you face to face. This is not meant to be comprehensive, so I do expect that you'll have questions, but hopefully it gives you a good amount of information on the procedure and recovery time. So on the day of surgery, you're going to be arriving at Rose Medical Center. You will be arriving 2 hours prior to the surgery. We do operate at Rose regularly, so we do have a consistent team of anesthesiologists and a surgical team that we work with regularly. Initially, you'll be brought back into the pre-op holding area, where nurses will start an IV and get things prepped and ready. They'll make sure that all current medications or medical history are updated in the computer. You will meet the anesthesiologist in the pre-op holding area, and oftentimes they'll even call you the day or night before. So if you do get a call from a number that you don't recognize that day or night before surgery, you may want to pick it up because it could be that anesthesiologist just trying to chat with you and get to know you a little bit before the day of surgery. You will also see Dr. Gazelli before surgery. He can answer any final questions that you have at that time. As far as the approximate time of the surgery and what your family should expect, times for this surgery can vary depending on how many levels we're addressing. So I will go over the specific details of your surgery face to face. We are happy to keep your family, friends, or whoever's with you there that day updated throughout the procedure. The nurses can call them from the operating room, and Dr. Gazelli will call or come see them after surgery as well. If they're there at the hospital, he'll come find them and sit down with them face to face to discuss the procedure and how you're doing. If they can't be at the hospital, that's okay. He's happy to call them on the phone as well. As far as what happens in the operating room, you may have already watched the procedure video, so you have a bit of a background on what we're going to be doing. And as I said earlier, we'll go in more detail or go over it in more detail in a little face-to-face. But the procedure is done with general anesthesia, and I'll go over a little recap and some commonly asked questions here. We will have people in there monitoring your spinal cord and spinal nerves during surgery. So after you're asleep, they're going to put little baby acupuncture needles all over from head to foot. And that's going to be reading the spinal cord and the spinal nerves. So during surgery, if anything starts acting abnormally, they will let Dr. Gazelli know right away. And I mentioned them to warn you a little bit in case you wake up with pinpricks, bruises, and bleeding. That's what that was from, is all those little needles. The incision for this surgery is typically made in the middle of your back, and it can be a bit of a long incision depending on how many levels, again, that we're addressing. This can be somewhat of a complex surgery, as I've already referenced, and it can vary depending on what we're doing, how many levels we need to decompress or stabilize in your case. So again, we'll go into those details more face to face. We do place screws and rods along with bone graft in order to stabilize the levels that are needing to be done. We also remove any bone or do decompression around nerve roots or spinal cord if that's also being done. The incision for this is closed with layers of dissolvable stitches. Oftentimes with this incision, typically it's going to be closed with staples. Sometimes it's dissolvable stitches or outside stitches, but in most cases it's going to be staples. We will let you shower that starting at 2 days after surgery, and we'll go in more detail with that in a little bit. Once the incision is closed, oftentimes we will put a drain in just to get that initial ooze off the incision. That will stay in for a day or two while you're in the hospital and be removed before you were to go home. But once the surgery is done, you'll be transferred over to the recovery room. The nurses there in the recovery room will monitor things and watch you as you're waking up, help control any discomfort or pain that you're having, and just make sure you're waking up enough to be alert and transferred over to the surgical floor. While you're at Rose Medical Center, you will be staying on our spine and orthopedic floor. There are spine nurses and physician assistants that will be taking care of you, and they are used to and know how to take care of a spine patient. All rooms there at Rose Medical Center are private, and you will not be sharing a room with another patient. We will have pain medications and muscle relaxants ordered for you, and the nurses can give those to you as needed. We'll also have physical therapists and occupational therapists working with you while you are there. And they'll work with basic daily living activities, as well as getting in and out of a bed, in and out of a chair, walking, doing stairs, all of those types of activities they'll be helping you with. You will be in a gown most of the time that you're in the hospital, but you're welcome to bring any comfortable, loose-fit clothing to wear, or especially just to go home in when you are discharged. You're also welcome to take or bring in any toiletries or other necessities such as that from home that you would like to. While you are there, you will see Dr. Gazzelli or myself on a daily basis. If you're there over a weekend, you will see Dr. Gazzelli, myself, or one of our other surgeons or physician assistants that may be on call that weekend taking care of our inpatients. But you will see somebody from our team every day. You will be discharged home once you are cleared by physical therapy and occupational therapy and that your pain is relatively managed. You will go home with pain medications and muscle relaxants. And I do remind you that I don't want you to take any anti-inflammatories for 3 months after surgery. And that includes Advil, Aleve, ibuprofen, Motrin, naproxen, those types of medications. Tylenol over the counter would be fine, but no other over-the-counter medications for that first 3 months. As far as what to expect initially or any restrictions that we place on you, we do want you walking, and that is your main therapy for the first 3 months. I want you alternating positions. I do not want you bedridden or chair-ridden at all after this surgery. If you're just sitting around watching TV or reading when you're at home, getting up and moving every 45 minutes to an hour to walk is usually what we ask of you. Walk around the house a little bit, get a drink of water, go to the bathroom. If it's nice out, feel free to take little walks throughout the day, but multiple little walks initially. As you're feeling up to it, you can stretch that to fewer, longer walks. And that will be your main therapy for the first 3 months. We do ask that you not do any bending, twisting, or lifting, and no other real exercise. You will also be given a brace for this surgery. And with this brace, you'll be wearing it anytime you're up and out of bed longer than about 5 to 10 minutes, meaning that you don't have to sleep in it. If you're getting up in the middle of the night to go to the bathroom and straight back to bed, you don't have to put it on. But once you're up for the day, whether you're sitting, standing, walking around, you'll have that brace on. So it gives you that stabilization that we need and that reminder not to do the bending, twisting, and lifting. You will also be wearing those white stockings or TED hose in the hospital. You'll go home with those and you can continue to wear them if needed. You don't have to wear them as long as you're getting up and walking a lot, but if you're not walking a good amount or if you're having any swelling in the feet or lower legs, definitely I'd like you to wear those longer. As far as showering and wound care goes, you can shower the second day after surgery. And so most of you'll be in the hospital still, so you'll do those first showers in the hospital. But even once you're home, you'll shower on a daily basis, taking the outer gauze bandage off of the incision and letting that soapy water trickle down your back and cleanse around the incision. Don't let the water pound on the incision and don't scrub on it. Don't soak it in a pool or a bathtub. Just showers only. And when you're done with the shower, just pat it dry and put a new gauze bandage on it. The main focus is to keep it clean and dry. No need for any ointments, lotions, or creams on the incision. With the medications that we give you, such as the pain medicines, typically that can cause a little bit of constipation. So we do recommend that as long as you're on pain medications, that you do a stool softener regularly. Of course, step it up to laxatives if you were needing something more. And if you switch over to the opposite and get diarrhea, then back off of all stool softeners and laxatives. With driving, we ask that you not drive as the driver for the first week or so, maybe up to your first post-op visit. A lot of that has to do with the pain medicines that are in your system and the stronger meds that were given during general anesthesia and during the procedure. We really don't want you behind the wheel when you're under the influence of those medications in your system. So we'll talk about that at your first post-op visit and whether or not we can clear you to drive. So as far as work goes, we do ask that you take some time off of work, and depending on what you do will depend on how long you have to be out of work then. People that do office-type sedentary work can get back to work within a couple of weeks, usually 2 to 4 weeks, depending on how you're feeling. Of course, you'll be wearing your brace and alternating positions when you do return to the office. You're welcome to work from home whenever you feel comfortable doing so. And as far as getting back into the office, usually regardless of when you go back to work, we do ask that you see if you can go back part days at first. So if you have that capability of going back maybe 4 hours a day initially for that first week, it's usually ideal, because all of the medications you've had in your system, the healing process from surgery, really wipes you out, and little activities that are normally no big deal for you will make you really tired. And so going back for a full day of work right away is going to be probably too much for you. So you can do those part days for a week or so and then increase your hours to normal full hours as tolerated. For those of you who have more physically demanding jobs like construction workers, unfortunately you're going to be out of full duty longer. Because we restrict you for 3 months of no bending, twisting, and lifting and just walking as therapy, we really won't allow you to do full duty type work. We then have to get you strengthened up with core strengthening with physical therapy after that 3-month mark. So to clear you to full duty, it's going to be probably a minimum of 4 months. If you have capability of doing light duty, we can definitely get you back earlier on a light duty status and then build our way up to full duty down the road. As far as any complications or other things to expect, with the incision, we expect that you'll have incisional pain and numbness around it from the skin disruption and muscle disruption. It takes a good 4 to 6 weeks for soft tissues to heal, so you will have this soreness for a while, but slowly getting better with time. Having said that, I also mentioned that keeping you in a brace for 3 months also allows those muscles to stay weakened, and so they stay more sore. So it's not abnormal for people to still have some back tightness or discomfort throughout that first 3 months at a mild level until they get strengthened up with physical therapy. We also may expect to see some persistent nerve symptoms if you're having leg symptoms prior to surgery. Our hope is that it's much better after surgery, if not resolved. But the nerves need to heal even once pressure is removed off of them, and that can take a while. So it's normal to still have some symptoms, but hopefully less constant and less severe. So as long as you're having those less constant, less severe, coming and going, but overall getting better type of symptoms, that's totally normal, and we would expect that. It can take months for the nerves to fully heal, so sometimes it's a little bit of a slow process for things to fully resolve. But on occasion, a nerve will get aggravated that we were in there, and it may have some increased pain or similar pain after surgery. If that's the case, we'll use some medications to help calm down that inflammation. But like I said, in general, we expect that symptoms should be improved after surgery. There's always the chance of a wound infection, especially with a larger wound. We do use antibiotics during surgery and during your hospital stay. So we do ask that you just keep an eye on the incision and keep it clean and dry. Typically there is a low chance of infection, but it can get infected, so we want to just keep an eye on things. There's always the chance for fusion failure, that the bone doesn't fully knit together, or hardware failure, that a bone that the hardware is in breaks or something. So we'll continue to monitor the hardware and fusion at every post-op visit. And like I said, it's also a low chance for this, but definitely can happen where the fusion doesn't fully grow together, or one of the pieces of hardware fails. So we mentioned it because it is a possibility. As far as when to call us, any changes in symptoms as far as worsening symptoms, increasing weakness, increasing pain, numbness, tingling, things that are just getting worse and worse and not getting better, we definitely want to know about that. As I said earlier, it's normal to still have some symptoms, and you could just have good days and bad days. Some days you notice it a little bit more than others, but overall it's improving, that's normal. But if it's not improving and it's going the opposite direction and getting worse, then definitely let us know about that. Any persistent fevers or signs of infection as well, please let us know. Increasing swelling, redness, drainage, things of that nature of the incision, please let us know. Persistent nausea and vomiting, we can help out with that with medications, so also call us, let us know about that as well. As far as when you'll see us next, we will see you at your first post-op around 7 to 10 days after surgery. At that visit, we will remove any staples or sutures. We will take x-rays and go over those x-rays with you there in the office so you can see everything. We will make sure that you're doing okay, or go over any questions or concerns that you have. We can refill medications if needed at that time. And at that visit, we'll also discuss driving and seeing if we can clear you to drive or not. We will then see you back at your 3-month post-op visit, at which time we'll talk about weaning out of the brace and starting physical therapy. We will then see you at 6 months and 1 year after surgery. We will get x-rays at every visit to monitor the hardware and monitor the fusion. And getting you back to normal. As I said, at 3 months after surgery, we will start physical therapy and we'll give you an order for that. We will have you start weaning out of the brace and gradually increasing your normal activities. You can gradually increase your bending, twisting, lifting, walking, normal activities, keeping in mind proper body mechanics when doing these types of things. The physical therapist can work with you in guiding you to get back to your normal exercises, your normal sports or physical activities that you enjoy doing. And again, a reminder that the fusion can take about 6 months to really knit together and fuse. So we will continue to monitor that throughout this process and throughout your post-op appointments, but it is something that takes some time for that bone to grow together. So hopefully this has given you a good amount of information on the procedure and the recovery time, but please feel free to call or email with any questions or concerns that you may have. Thank you.